Hello everyone. Today we are going to discuss about co-trimoxazole. So we'll be discussing the co-trimoxazole under following competencies. First, we'll discuss about mechanism of action, antimicrobial spectrum, therapeutic uses, adverse effects, and drug interactions. Co-trimoxazole is a fixed dose combination of sulfamethoxazole with trimethoprim at a ratio of 5:1, which give rise to a plasma concentrations of 20:1. So this co-trimoxazole, it causes sequential blockade of folate metabolism. Sulfamethoxazole is an intermediate acting sulfonamide antimicrobial agent, which I have discussed earlier. And trimethoprim, which is a diaminopyridine derivative, selectively inhibit the bacterial dihydrofolate reductase enzyme. So individually, both the trimethoprim and sulfamethoxazole are bacteriostatic in nature, but the combination become bactericidal. The optimal synergistic effect is observed when plasma concentrations of sulfamethoxazole and trimethoprim is at 20:1, and this ratio can be achieved in the plasma by combining these two agents in a fixed dose ratio of 5:1. This is due to the difference in their pharmacokinetic properties. Trimethoprim is rapidly absorbed, but it has large volume of distribution and thus concentration in many tissue. So plasma concentration obtained is lower as compared to sulfamethoxazole. Plasma protein binding is 40% for trimethoprim and 65% for the sulfamethoxazole.
Coming to the mechanism of actions of co-trimoxazole, so as I have mentioned previously, para-aminobenzoic acid is a precursor of folic acid, and folic acid is required for bacterial growth and multiplications. So, para-aminobenzoic acid, in presence of folate synthetase enzyme, it get converted to the dihydrofolic acid. Dihydrofolic acid, in presence of dihydrofolate reductase enzyme, it get converted to the tetrahydrofolate acid. Now, tetrahydrofolate or tetrahydrofolic acid, they in turn responsible for the bacterial growth and multiplications. So, sulfomethoxazole, which inhibit the folate synthetase enzyme, which produce the individually bacteriostatic actions, whereas trimethoprim, it individually produce bacteriostatic effect and which inhibit the dihydrofolate or dihydrofolic reductase enzyme. So this combinations therapy sequentially they inhibit the synthesis of folic acid in two step and therefore producing the synergistic effect. Individually, both the trimethoprim and sulfamethoxazole are bacteriostatic, but these combinations become bactericidal. Since the human being use preformed folic acid, the sulforamide do not affect the human cells. The trimethoprim is highly selective for bacterial cell, so human cells are not affected in therapeutic concentrations. So this co-trimoxazole, it is a rational fixed dose combinations. This is because the individually both are bacteriostatic in nature, but the combinations become bactericidal. The combinations therapy decrease the minimum inhibitory concentrations up to 3 to 6 times of both the agents, which resulted in increase the antimicrobial spectrum. So these combinations the decrease chances of development of antimicrobial resistance. Individual agents have similar T high, that is 10 hour, so that we could able to combine this sulfamethoxazole with a trimethoprim.
Coming to the antimicrobial spectrum of co-trimoxazole. The spectrum of co-trimoxazole is wide as compared to either constituent alone. So they can be effective against Salmonella typhi, which cause the typhoid, Yersinia enterocolitica, which is really responsible for enterocolitis, Pneumocystis cerevisiae, which cause pneumonia, Nocardia, which is responsible for nocardiosis, Klebsiella, Streptococcus pyogenes, and Staphylococcus aureus, enteropathogenic E. coli. To the therapeutic uses of cotrimoxazole, they can be effective against the uncomplicated lower urinary tract infections. So they also can be effective against acute, chronic, and recurrent lower urinary tract infections at a dose of 800 milligram plus 160 milligram as a FDC fixed dose combinations, and frequency will be twice a day for 3 days for uncomplicated cystitis. The combo also can be effective in against the prophylaxis in recurrent urinary tract infections, but at lower concentrations. So 10 to 15 days treatment regimens can be implicated in case of pyelonephritis. As these drugs, they concentrated in prostate, so they also can be effective in prostatitis. So in acute case, treatment regimens will be continued for 3 weeks, whereas chronic cases, the treatment regimens require 6 to 12 weeks of treatment. Coming to the bacterial respiratory tract infections. So cotrimoxazole is effective for outpatients with mild acute exacerbations of chronic bronchitis. So it is also useful for infections due to the gram-positive cocci like Staphylococcus pneumonia and Haemophilus influenzae. They are also effective against the acute otitis media in children and acute maxillary sinus in adult. It is effective for both the upper and lower respiratory tract infections. Coming to the typhoid. So if strain of Salmonella typhi are sensitive, cotrimoxazole is a cheaper alternative as compared to fluoroquinolones, that is ciprofloxacins. So ciprofloxacin is currently a drug of choice. Coming to the GI infections. So the combinations is alternative to a fluoroquinolones for the treatment of shigellosis, but increasing resistance limit its use unless susceptibility is confirmed. So the diarrhea caused by Yersinia enterocolitica, it is a drug of choice, but these combinations are no longer recommended for prevention or treatment of traveler diarrhea because of increasing resistance worldwide among the likely pathogens. So it is less effective than the fluoroquinolones for diarrhea due to the cholera. Coming to the nocardiosis, so it is a drug of choice pulmonary lesions or brain abscess to nocardia. Coming to the brucellosis, so they can be effective against the brucellosis in combinations with the gentamicins. Coming to the STD or sexually transmitted disease, so it is a drug of choice for chancroid due to the Haemophilus ducrei. So non-specific urethritis, lymphogranuloma due to the chlamydia, and gonorrhea due to the Neisseria gonorrhea may also be treated by this combination therapy. So chancroid, so caused by Haemophilus ducrei, it is a drug of choice is azithromycin, but cotrimoxazole is equally effective against the chancroid. Adverse effects of cotrimoxazole. So they are adverse effects are quite similar to sulfonamide in respect to the adverse effect. So first we'll start with gastrointestinal adverse effect, which include nausea, vomiting, and abdominal discomfort. Coming to the hemolytic anemia. So they do process hemolytic anemia, but at a higher dose due to inhibitions of conversions of folic acid to folinic acid by trimethoprim. So for the same reason, if co-trimoxazole is used during the pregnancy, their chances of teratogenic effect due to folate deficiency will be increased. Apart from anemia, they do process coagulation disorders, purpura, granulocytopenia. Coming to the dermatological reactions, they process just like sulfonamide, they also process skin rashes, neutropenia, and specific adverse effect like SJ syndrome or Steven-Johnson syndrome. Occasionally, they do process CNS disturbances. Coming to drug interactions. So, co-trimoxazole should not be combined with anticoagulant drugs like warfarin and hydantoin derivatives like phenytoin and fosphenytoin because this drug they potentiate the actions of the warfarin and hydantoin derivative, resulted in adverse effect of above drugs. Coming to the next drug interactions, that is the co-trimoxazole should not be combined with anti-cancer drug like methotrexate, which resulted in serious methotrexate toxicity. So let's discuss about the summary of today's lecture. So co-trimoxazole is a fixed dose combination of sulfamethoxazole with trimethoprim at a ratio of 5:1, which give rise to a plasma concentration of 20:1. This combination therapy decrease minimum inhibitory concentrations up to 3 to 6 times of both the agents, resulted in increased antimicrobial spectrum. Coming to the adverse effect of co-trimoxazole, which include hypersensitivity reactions like Steven-Johnson syndrome, hematuria, oliguria. Co-trimoxazole should not be combined with warfarin and hydantoin derivatives like phenytoin and fosphenytoin because they potentiate their actions.